Dexmedetomidine. Expanded lecture note. Dexmedetomidine. A unique sedative in critical care and procedural settings. Known for providing sedation with minimal impact on breathing. Acts on ALPHA2 receptors for sedation. ICU sedation, procedural sedation. Less respiratory depression, patients are easily arousable. Can cause low blood pressure, slow heart rate. Let's explore its uses, benefits, and considerations. Objectives. By the end of this presentation, participants should be able to 1. Define dexmedetomidine and classify it. 2. Explain its mechanism of action, pharmacokinetics, and pharmacodynamics. 3. Discuss its clinical uses in ICU, anesthesia, and emergencies. 4. Identify side effects, contraindications, precautions, and drug interactions. 5. Describe its administration, dosage, and nursing management. 6. Compare dexmedetomidine with other sedative agents. 7. Highlight current trends, research, and patient education aspects. Other names. 1. Generic. Dexmedetomidine, the non-brand name of the medication. 2. Trade names. Precedex, Dextor, Dexmed, these are brand names under which dexmedetomidine is sold. 3. Class. Highly selective alpha-2 adrenergic receptor agonist, means dexmedetomidine targets specific receptors, ALPHA2, in the body for its effects. 4. Developed as a more potent and selective version of clonidine, dexmedetomidine was made to be more targeted and effective compared to another similar drug, clonidine. Introduction to dexmedetomidine. 1. Dexmedetomidine is a sedative, anxiolytic, and analgesic-sparing drug widely used in anesthesia and ICU, meaning its use to calm patients, reduce anxiety, and help manage pain in these settings. 2. Unique because it produces cooperative sedation. Patients are calm but easily arousable. This means patients can be woken up easily and follow commands while on dexmedetomidine. 3. Research supports its use in reducing delirium, opioid consumption, and ventilator dependence in ICU. These show dexmedetomidine can help reduce these issues in ICU patients. 4. Increasingly replacing benzodiazepines like lorazepam, midazolam for ICU sedation. Dexmedetomidine is being used more often instead of these other sedatives in the ICU. 5. Dexmedetomidine is a highly selective alpha-2 adrenergic receptor agonist with sedative, anxiolytic, and analgesic-sparing properties. It targets ALPHA2 receptors for its effects. 6. Unlike most sedatives, it produces sedation without significant respiratory depression. Dexmedetomidine doesn't slow down breathing much. 7. Allows for cooperative or arousable sedation, making it ideal in ICU and perioperative settings. Patients are sedated but can be easily awakened. The myths. Debunking myths about dexmedetomidine. 1. Myth. Dexmedetomidine causes respiratory depression like other sedatives. People think it affects breathing like other sedatives. Reality. Minimal respiratory depression, even at higher doses. Dexmedetomidine doesn't slow breathing much, even if more is given. 2. Myth. It is an analgesic. People think dexmedetomidine is a pain reliever. Reality. Provides analgesic-sparing effect but not a strong analgesic by itself. Dexmedetomidine helps reduce the need for meds but isn't a strong pain reliever on its own. 3. Myth. Dexmedetomidine is safe in all patients. People think it's safe for everyone. Reality. Can cause severe bradycardia and hypotension. Dexmedetomidine can cause slow heart rate and low blood pressure in some patients. Classical definition of dexmedetomidine. 1. Dexmedetomidine is an intravenous sedative. It's given through a vein to sedate patients. Works via central alpha-2 adrenoceptor activation. Dexmedetomidine acts on ALPHA2 receptors in the brain, reducing sympathetic activity. This means it calms down the body's stress response, producing sedation, analgesia, and anxiolysis without major effects on respiratory drive. Dexmedetomidine calms, helps with pain, reduces anxiety, and doesn't affect breathing much. 2. Dexmedetomidine is a highly selective alpha-2 adrenergic agonist. It targets ALPHA2 receptors specifically for its effects. Provides sedation, anxiolysis, and modest analgesia with minimal respiratory depression. Dexmedetomidine sedates, reduces anxiety, helps a bit with pain, and doesn't slow breathing much. History. 1. Developed in the 1990s as a more selective form of clonidine. 2. Approved by FDA in 1999 for short-term, less than 24 hours, ICU sedation. 3. Now widely used in perioperative anesthesia and procedural sedation. Classification of dexmedetomidine. 1. Pharmacological class. Alpha-2 adrenoceptor agonist. Dexmedetomidine acts on ALPHA2 receptors for its effects. 2. Therapeutic class. Sedative analgesic adjunct. Dexmedetomidine is used to date and help with pain management. 3. Control status. Prescription-only medication in most countries. Dexmedetomidine needs a doctor's prescription to get in most places. Chemical properties of dexmedetomidine. 1. Chemical name. S-4,1,2, 3-dimethylphenyl ethyl -3-H-imidazole. This is the formal chemical name of dexmedetomidine. 2. Molecular formula. C13H16N2. This shows the enzymes making up dexmedetomidine. 3. Molecular weight. 200.28 grams per mole. This is the weight of one molecule of dexmedetomidine. 4. Structure. Imidazole derivative. Dexmedetomidine is based on an imidazole chemical structure. 5. Chirality. Dexmedetomidine is the S-enantiomer of medetomidine. More potent. Dexmedetomidine is a specific form, S form, of medetomidine and is more effective. Physical properties of dexmedetomidine. 1. Appearance. Clear, colorless solution. Dexmedetomidine looks like a clear liquid with no color. 2. pH. 4.5–7.0. This is the acidity-basicity range of dexmedetomidine solution. 3. Solubility. Freely soluble in water and ethanol. Dexmedetomidine dissolves easily in water and ethanol. 4. Stability. Light sensitive. Store at room temperature. Dexmedetomidine can break down if exposed to light, so store it at normal room temps. 5. Supplied as concentrated solution, usually 100 micrograms per milliliter, diluted before infusion. Dexmedetomidine comes in a strong solution that needs to be diluted before giving to patients. Mechanism of action of dexmedetomidine. 1. Selectively binds to alpha-2 adrenoceptors, alpha-2. Alpha-1 selectivity approximately 1600. 1. In the brainstem, locus coeruleus, and spinal cord. Dexmedetomidine targets ALPHA2 receptor mainly in these areas. 2. Central effects. Reduce norepinephrine release leading to sedation, analgesia, anxiolysis. In the brain, dexmedetomidine reduces norepinephrine, causing sedation, pain help, and reduced anxiety. 3. Final effects. Inhibition of nociceptive transmission in dorsal horn leading to analgesia. In the spine, dexmedetomidine helps reduce pain signals. 4. Does not act on GABA receptors, unlike Propofol benzodiazepines, so sedation is unique. Patients are sedate easily arousable. Dexmedetomidine's sedation is different because it doesn't work like some other sedatives, Propofol, benzodiazepines, on GABA receptors, so patients wake up easily. Pharmacokinetics of dexmedetomidine. 1. Absorption. IV administration, immediate onset. Dexmedetomidine is given through a vein and starts working right away. 2. Distribution. Rapid. Volume of distribution approximately 118 L. Dexmedetomidine spreads through the body quickly. 3. Protein binding. Approximately 94% most of dexmedetomidine binds to proteins in the blood. 4. Metabolism. Hepatic glucuronidation. 2 cypriot pounds A6-mediated hydroxylation, dexmedetomidine broken down in the liver. 5. Elimination. Renal excretion of metabolites. The broken down parts of dexmedetomidine leave the body through the kidneys. 6. Half-life. Approximately 2 hours. Context-sensitive half-time increases with prolonged infusion. Dexmedetomidines effects reduce in about 2 hours, but this can change if given for a long time. Pharmacodynamics of dexmedetomidine. 1. Onset. Within 5 to 10 minutes after bolus, loading dose. Dexmedetomidine starts working within a few minutes after the initial dose. 2. Peak effect. Approximately 15 minutes. Dexmedetomidine's effects are strongest around 15 minutes after given. 3. Duration. Sedation maintained with continuous infusion. Recovery within approximately 1 to 2 hours after stop. Sedation continues if dexmedetomidine is infused continuously. Patients recover in about 1 to 2 hours after stopping. 4. Hemodynamic effects. Dose-dependent downpointing arrow HR and BP due to sympatholysis, depending on dose. Dexmedetomidine can slow heart rate and lower blood pressure because it reduces the body's stress response. Storage and disposal of dexmedetomidine. 1. Store at 20 to 25 degrees Celsius. Protect from light. Dexmedetomidine should be kept at room temperature and away from light. 2. Use diluted infusion within 24 hours. Once dexmedetomidine is mixed for infusion, use it within a day. 3. Dispose per hospital pharmacy and controlled drug policies. Get rid of dexmedetomidine according to the hospital's rules for medicines. Drug interactions of dexmedetomidine. 1. Additive effect with opioids, benzodiazepines, propofol leading to enhanced sedation. Dexmedetomidine can increase sedation when used with these other medicines. 2. Potentiates antihypertensives and beta blockers leading to bradycardia, hypotension risk. Dexmedetomidine can make blood pressure and heart rate lowering medicines stronger, possibly causing slow heart rate or low blood pressure. 3. Care with vasodilators and anesthetic agents. Be careful using dexmedetomidine with medicines that widen blood vessels or with anesthetics. Clinical uses of dexmedetomidine. 1. Sedation for ICU patients on mechanical ventilation. Dexmedetomidine sedates ICU patients on breathing machines. 2. Sedation for non-intubated patients during procedures. Dexmedetomidine sedates patients not on tubes during procedures. 3. Adjunct in general and regional anesthesia. Dexmedetomidine helps with general or regional anesthesia. 4. Short-term sedation in post-anesthesia care unit (PACU). Dexmedetomidine is used for short sedation after surgery in recovery. 5. Analgesic adjunct in perioperative period. Dexmedetomidine helps with pain around the time of surgery. 6. Sedation during awake fiber optic intubation. Dexmedetomidine sedates patients during a type of breathing tube placement while they're awake. Use of dexmedetomidine in anesthesia. 1. As premedication to reduce anxiety. Dexmedetomidine can be given before anesthesia to lower anxiety. 2. Intraoperative infusion to reduce anesthetic and opioid requirements. Dexmedetomidine given during surgery can lower the need for other anesthetics and pain meds. 3. Sedation for awake craniotomy or awake regional anesthesia. Dexmedetomidine sedates patients during certain awake surgeries like brain or regional anesthesia. 4. Smooth emergence from anesthesia with reduced agitation. Dexmedetomidine can help patients wake up smoothly from anesthesia with less agitation. Use of dexmedetomidine in emergencies. 1. Sedation during difficult airway management, awake intubation. Dexmedetomidine sedates patients during tricky breathing tube placements while they're awake. 2. Sedation in agitated patients with respiratory compromise where other sedatives are risk. Dexmedetomidine can sedate agitated patients with breathing issues where other sedatives might be risky. 3. Adjunct in rapid control of severe ICU delirium. Dexmedetomidine helps control severe confusion in ICU patients. 4. Procedural sedation unstable patients. Dexmedetomidine sedates unstable patients during procedures. Nursing management of dexmedetomidine. 1. Continuous cardiac and BP monitoring. Nurses check heart and blood pressure constantly. 2. Watch for bradycardia, hypotension. Nurses look out for slow heart rate or low blood pressure. 3. Assess sedation level regularly. Nurses check how sedated the patient is often. 4. Ensure infusion pump accuracy. Nurses make sure the pump giving dexmedetomidine is working right. 5. Educate patients. Cooperative sedation equals they may still be aware. Nurses tell patients that with dexmedetomidine sedation, they might still be somewhat aware. Administration and dosage of dexmedetomidine. 1. ICU sedation. 1. Loading dose. 1 microgram per kilogram over 10 minutes, optional, may be skipped in unstable patients. In ICU, dexmedetomidine might start with a dose over 10 minutes, option in unstable patients. 2. Maintenance. 0.2–0.7 microgram per kilogram per hour, up to 1.4 micrograms per kilogram per hour. In some cases, dexmedetomidine is usually given continuously in ICU at this rate. 2. Procedural sedation. 1. Loading. 1 microgram per kilogram over 10 minutes. 2. Maintenance. 0.2–1 microgram per kilogram per hour. For procedures, dexmedetomidine dosing is similar but with a range for maintenance. 3. Adjunct in anesthesia. 1. Infusion. 0.2–0.7 microgram per kilogram per hour intraoperatively. 2. Bolus. 0.5–1 microgram per kilogram before induction or during surgery. Dexmedetomidine helps in surgery at these doses. 3. Note: avoid rapid bolus. Right pointing arrow can cause severe bradycardia and hypotension. Giving dexmedetomidine too fast can cause slow heart rate and low blood pressure. Side effects of dexmedetomidine. 1. Bradycardia. Dexmedetomidine can slow the heart rate. 2. Hypotension. Due to vasodilation and decreased sympathetic tone, dexmedetomidine can lower blood pressure because it widens blood vessels and calms the body's stress response. 3. Hypertension. Transient. During loading dose from peripheral vasoconstriction, sometimes dexmedetomidine briefly raises blood pressure when first given due to blood vessel narrowing. 4. Dry mouth. Patients might get a dry mouth with dexmedetomidine. 5. Nausea, vomit. Dexmedetomidine can cause nausea or vomiting. Serious side effects of dexmedetomidine. 1. Severe bradycardia leading to cardiac arrest, rare. Especially in high vagal tone, dexmedetomidine can rarely cause very slow heart rate leading to cardiac arrest, more so in certain patients. 2. Profound hypotension in hypovolemic or unstable patients. Dexmedetomidine can cause very low blood pressure in patients with low blood volume or unstable patients. 3. Heart block in predisposed individuals. Dexmedetomidine might cause heart block in some patients with certain heart conditions. 4. Withdrawal symptoms with abrupt discontinuation after prolonged infusion. Stopping dexmedetomidine suddenly after giving it for a long time might cause withdrawal symptoms. Contraindications of dexmedetomidine. 1. Known hypersensitivity to dexmedetomidine. Don't use dexmedetomidine if patients are allergic to it. 2. Advanced heart block. Unless paced, dexmedetomidine isn't for patients with severe heart block unless they have a pacemaker. 3. Severe ventricular dysfunction. Dexmedetomidine might not be for patients with severe heart pumping problems. 4. Hypotension, shock unresponsive to treatment. Dexmedetomidine isn't for patients with low blood pressure or shock that doesn't get better with treatment. Precautions for dexmedetomidine. 1. Use cautiously in patients with 1. Bradyarrhythmias. Be careful with dexmedetomidine in patients with slow heart rhythms. 2. Hypovolemia. Use dexmedetomidine carefully in patients with low blood volume. 3. Hepatic impairment. Reduce dose, lower dexmedetomidine dose in patients with liver problems. 2. Avoid rapid loading in unstable patients. Don't give dexmedetomidine too fast in unstable patients. 3. Taper after prolonged infusion to avoid withdrawal hypertension, tachycardia. Slowly stop dexmedetomidine after long use to avoid high blood pressure or fast heart rate from withdrawal. Advantages of dexmedetomidine. 1. Minimal respiratory depression. Dexmedetomidine doesn't slow breathing much. 2. Cooperative, easily arousable sedation. Patients are sedated but can wake up easily and cooperate. 3. Opioid-sparing and anesthetic-sparing effect. Dexmedetomidine can lower the need for pain meds and anesthetics. 4. May reduce incidence of ICU delirium. Dexmedetomidine might help lower confusion in ICU patients. 5. Good for difficult airway sedation. Dexmedetomidine is useful for sedating patients with tricky breathing tube placements. Disadvantages of dexmedetomidine. 1. Slow onset compared to Propofol. Dexmedetomidine takes longer to work than Propofol. 2. Hemodynamic instability, bradycardia, hypotension. Dexmedetomidine can cause slow heart rate or low blood pressure. 3. Higher cost compared to other sedatives. Dexmedetomidine costs more than some other sedating medicines. 4. Not ideal for deep sedation or induction of anesthesia. Dexmedetomidine isn't best for very deep sedation or starting anesthesia. Clinical considerations for dexmedetomidine. 1. Monitor HR and BP closely. Check heart rate and blood pressure often with dexmedetomidine. 2. Avoid or slow loading dose in hemodynamically unstable patients. Be careful with the initial dose in unstable patients. 3. Best suited for patients where spontaneous breathing must be preserved. Dexmedetomidine is good for patients who need to breathe on their own. 4. Adjust dose in hepatic impairment. Change dexmedetomidine dose in patients with liver problems. 5. Avoid abrupt discontinuation after prolonged infusion. Don't stop dexmedetomidine suddenly after giving it for a long time. Comparison of agents with dexmedetomidine. Propofol, Midazolam. 1. Dexmedetomidine. Sedation depth. Light moderate. Respiratory depression. Minimal. Onset. 5 to 10 minute. Analgesia. Moderate. Recovery. Heart rate, HR, stable blood pressure, BP, hemodynamics. Lowers HR, BP. Delirium risk. Lower, ICU suitability, excellent. 2. Propofol. Sedation depth. Light deep, respiratory depression. Significant, onset. 30 seconds, analgesia. None, recovery, rapid. Hemodynamics. Lowers BP, increases heart rate, HR, delirium risk, higher. ICU suitability, good for short term. 3. Midazolam. Sedation depth. Light deep, respiratory depression. Significant, onset. 1 to 5 minute, analgesia. None, recovery. Slow moderate, hemodynamics. Mild effect on BP, delirium risk. Higher, ICU ability, good for long term. Additional information on dexmedetomidine. 1. FDA approved for ICU sedation up to 24 hours, but widely used longer. Dexmedetomidine is approved for 24 hours in ICU but often used longer. 2. Also used in cardiac surgery for its sympathetic effects, dexmedetomidine helps in heart surgery by calming the body's stress response. 3. Studied in pediatric MRI sedation, dexmedetomidine is being looked at for sedating kids during MRI scans. Current trends in dexmedetomidine. 1. Expanding role in opioid-sparing anesthesia. Dexmedetomidine is being used more to lower the need for opioids in anesthesia. 2. Preferred sedative in ERAs, enhanced recovery after surgery, protocols. Dexmedetomidine is like protocols that help patients recover faster after surgery. 3. Research on use in pediatrics, delirium prevention, and regional anesthesia adjunct. Researchers are studying dexmedetomidine for use in kids, preventing confusion, and helping with regional anesthesia. Research on dexmedetomidine. 1. Trials show dexmedetomidine reduces ICU delirium vs benzodiazepines. Studies say dexmedetomidine causes less confusion in ICU than benzodiazepines. 2. Being studied for neuroprotection in brain injury. Researchers are looking at if dexmedetomidine protects the brain in injury. 3. Research ongoing into long-term safety and cost-effectiveness. Studies are checking if dexmedetomidine is safe and worth the cost for long-term use. Patient education on dexmedetomidine. 1. You may feel sleepy but can still be aroused. Dexmedetomidine makes you sleepy but you can wake up. 2. Report palpitations, dizziness, chest discomfort. Tell your care team if you feel heart racing, dizzy, or chest discomfort. 3. Not to be confused with strong painkiller. It helps calm and reduces pain indirectly. Dexmedetomidine isn't a strong pain med but helps you calm down and might lower pain. Conclusion on dexmedetomidine. 1. Dexmedetomidine is a unique sedative that enables light, cooperative sedation with minimal respiratory depression, making it highly valuable in ICU, anesthesia, and emergency care. 2. Its hemodynamic effects require careful monitoring, but when used appropriately, it can improve patient comfort, reduce delirium, and enhance safety in high-risk patients. Take-home tips on dexmedetomidine. 1. Highly selective alpha-2 agonist leading to sedation, anxiolysis, analgesic sparing. Dexmedetomidine targets alpha-2 receptors causing sedation, lowers anxiety, and reduces need for pain meds. 2. Cooperative sedation without respiratory depression. Dexmedetomidine sedates patients who can still cooperate and breathe normally. 3. Watch for bradycardia and hypotension. Be careful of slow heart rate and low blood pressure with dexmedetomidine. 4. Safer than benzodiazepine ICU sedation. Dexmedetomidine might be safer than benzodiazepines for sedating ICU patients. 5. Growing role in modern anesthesia and critical care. Dexmedetomidine is being used more in current anesthesia and critical care practices. Professional quote. Dexmedetomidine doesn't just sedate the patient. It allows them to rest without silencing their breath. Critical care sedation principle. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.